Thanks for tuning in to Lincoln County Connections today. We are in our third week of COVID-19 coronavirus specific radio programming, and I'd like to welcome Nicole Fields. She is the Deputy Director of Public Health. Good morning.
Yes. Good morning, Casey. Thanks for having me.
Oh, pleasure to have you here, Nicole. And we're going to talk today about, perhaps some myths, some common concerns we've been seeing, recently, and it's good to have you here because over time, as this has evolved for me, I'm like, wow, Nicole is just so on top of things. I just appreciate everything that you're doing. And I do want to ask you, so you're the Deputy Director. Where do you live in our organization? What does that look like?
Great, thanks, Casey. So in our organization, I oversee all of the public health programming. So that includes our WIC program, our communicable disease nurses, health promotion, which works on a lot of population-based health initiatives, our environmental health team, and then I work closely with our maternal child health team as well.
So I'm so impressed the way public health is just sort of mobilized around everything that we're doing in response and public information. So you sort of picked people from different areas and they came into our Joint Information Center, and the team is just doing so good. I mean, how do you feel about how everything is going?
Our team is amazing, and I'm so proud to be working alongside of them every day. I think for a lot of people, it was a huge change in their day-to-day job. Like, for example, we have one of our environmental health inspectors that's answering all of the emails that come into our call center email address. And just seeing how everyone has adjusted to their new roles and have been so willing to help and jump in and join the team has been, I've just been so impressed and really proud to work with the team.
Yeah, I totally agree. I mean, it's just amazing what we've done, and we do all this training around emergency response, and to see it come together and see that pay off is really a good feeling, to know that we are capable and that meant something, and here we are in coronavirus. And so I think maybe we should jump into some of the questions we've seen recently, and I just noticed that it took that first case to kind of change the public perception around this. And could you just rewind though a little bit? I mean, I was skeptical at first, but you guys have been working on this for a while.
Yeah, so public health really takes a deep dive into population health and projecting out some of the scenarios that could affect the health of the population as a whole. Yeah. So when we started hearing about this several months back in China and in Europe, and in some of those countries like Iran and Italy that started seeing this virus spread, we started taking preparation steps immediately as far as getting our policies in place, monitoring that data and information, and taking a look at our response structure and our personal protective equipment supplies to make sure that when and if it came to the United States, we would be ready to respond.
Yeah, and I mean, I feel like maybe it's not untypical for some folks, like how I was. I saw you guys mobilizing, there were meetings, the planning began, and then over time it's just sort of evolved and evolved and evolved. This trajectory, this curve that we're talking about flattening, there's some positive things here that we're seeing, right? You've got some data.
Yeah, absolutely. So data is coming out that's saying that social distancing is working. I think some of the first states that have done social distancing protocols and kind of really put in aggressive policies to keep people at home and keep people only going out for essential services, their numbers are starting to kind of flatten already. And we're not quite at that point where our numbers in Oregon are flattening. However, we can start to see the impact, and we can start to see that it really is working and that people are careful, because there were a lot of people that were feeling really skeptical at first, and especially being out in a rural community, it might feel like maybe this is something that is more likely to hit in an urban center, but this is spread all the way across the United States. And it just takes some people or one family or one group of people not following social distancing, and it can spread really, really quickly in a rural community. And I'm obviously not here to scare anyone, but I read a news article yesterday about a really small town in Georgia where someone unfortunately passed away, and they held a funeral, and 200 people came in person to the funeral.
Oh my gosh.
And now 26 more people have died of coronavirus because they gathered in a mass gathering. And it just shows that it doesn't matter if you're urban or rural, we need to practice really vigilant social distancing right now until we get through this.
Yeah. Yeah, as hard as it is, and as this wears on and things, get blurry, there might be that tendency to forego that. But like you're saying, we really don't know where we are in the big picture, and we just can't relent.
Yeah. It's hard. I mean, I think everyone kind of understands that it can feel really isolating and really lonely, and really challenging and boring and difficult to be in your house for a month, whether you're by yourself or you're with your family. It's disrupted your routine. You're used to going out and seeing people and socializing, and you really miss that social connection. And so I think kind of switching people's focus to, this is what we have to do to get through this, but there are other ways that you can look at socialization, whether it is getting on a video chat with your family, or kind of seeking some online connections, writing letters. I mean, there are a lot of other ways to kind of foster those social needs, but right now we need people to stay at home.
Yeah, it's interesting. I have seen some people say that it's a chance to reestablish connections, and changing that frame to what's positive about it is definitely something we need to dig into in our toolbox. Well, let's take our first break. We're talking to Nicole Fields. She is the Deputy Public Health Director, and we'll be back in a moment. On Lincoln County Connections today, we are talking to Nicole Fields, Deputy Director of Public Health. Nicole, definitely what we've seen in recent days in regard to public inquiry has been about, well, why aren't we releasing data about what city someone's from and tested positive? And actually, before you answer that, can you tell us what our numbers are right now?
Sure. So in the state of Oregon, there are 736 cases confirmed of COVID-19. In Lincoln County specifically, there are 3 confirmed cases.
Okay. So we've had 3 so far, but why don't we say what city it is, and how can we understand this?
So that's a question we're hearing a lot, and we understand that people may feel safer if, for instance, if you're in Yachats and you hear there's a case all the way up in Lincoln City, you might feel safer. You might feel like, all right, great, this isn't in my neighborhood, this isn't in my community, I can go out, I can do things, and that's just not accurate right now. So I think the question that I would ask folks who are asking why we can't release city data is if there's something that you would do differently if you knew what city these people were in. And if the answer to that is yes, then you need to do that now, because that means that there's some extra precautions you can take around social distancing and around protecting yourself that you're not taking. And I don't mean that to sound harsh, but I think it's the reality with how testing rolled out in Oregon as well, that if people were showing mild to moderate symptoms where they did not need medical care right away, we're having them shelter at home, just so we don't end up overburdening the healthcare system in our state right now. So if people are, mild to moderate with a cough and a fever and they are isolated at home, we have no way to say that they've tested positive. And so if we start, putting out city locations, it might give people a false sense of security, because the likelihood is that there are other cases in our county that we have not confirmed. And so there's just no real way to know where they all are. And I think the most important thing for people to remember is that you need to be vigilant and take care of yourself.
And also the process when someone tests positive, we don't release names, and is that really a HIPAA-driven thing too as well?
Yeah, it's for privacy purposes. And I do want people to know that when we get a positive case in our county, within hours, we've contacted that case and we've reached out to anyone that they had close contact with to let those people know that they've had contact with the case and that they need to isolate at home and monitor themselves for symptoms. So we're telling people if they've had contact with someone that is a confirmed case of COVID-19, we are absolutely letting you know and letting you know how to keep yourself safe.
Nicole, great idea. We need to plug the call center.
We do.
It's such a great thing.
It is. We're really
Yeah.
excited, and kind of goes back to what a wonderful team we have at Health and Human Services, because we had staff volunteer to staff our call center. And what that is it's open Monday through Friday from 9 a.m. to 1 p.m. And they are more than happy to take calls of your questions about COVID-19 and what it means for you and how it applies to you, as far as if you need connections to resources, if you need connections to services, whether that's a primary care provider, or they can give you information on things like signing up for WIC or signing up for OHP, which might be new for a lot of people. So it's a really great resource. Again, it's open 9 a.m. to 1 p.m. Monday through Friday. And their phone number is 541-265-0621. You can also email them at Lincoln CO Call Center at co.lincoln.or.us.
So there is Spanish staff on certain days. Do you recall which days those are?
We have bilingual Spanish-English staff in the call center on Wednesdays and Thursdays.
But Monday through Friday, 8 to 5, any inquiries by email in Spanish can be managed fairly quickly?
Yes, that's correct.
Okay, so call center is open, that's 9 to 1 generally. I would say maybe check the website too for this information, because we could expand staffing and hours going into the future, or things could change. So
yeah, we're kind of a small but mighty team. If you're interested in volunteering for the county as well, you can always contact us through our website, and we can hook you into our volunteer system.
Could you just talk just a little bit about what you do know about Samaritan's call center too, by the way?
Sure. So Samaritan also has a call center, and that's more for if you have questions about perhaps you're feeling like you may be showing some symptoms of COVID-19, for instance, a fever, cough, shortness of breath, something like that, or if you're afraid you may have come in contact with someone who has COVID-19, or if you're awaiting test results, they can kind of help you navigate that. Their call line is actually staffed with registered nurses. It's a regional line, so it serves Lynn, Benton, and Lincoln County. They are open 7 days a week from 8 a.m. to 7:30 p.m. And their number is 541-451-7425.
You have that memorized.
I was cheating. It's on.
Oh, you were. I'm impressed. I'm like, wow, photographic memory. So as far as other county services and continuity on the public health end, I mean, we continue to be doing other things as well. Maybe there is a conception that things aren't open, but you want to talk about kind of our primary services that still continue to roll?
Yeah, absolutely. So we are still open for business. It just looks a little bit different right now.
Yeah.
We realize that people are likely going through a lot of changes right now, whether that is a change in employment, a change in housing, a change in income, or just a change in their status, where they may have been out in the community a lot before and now they're at home, and so they might need some additional services. So our behavioral health team and our primary care team are still seeing patients. You can go onto our Lincoln County website for information if you're interested in signing up for services. We also have someone that can help navigate getting you signed up for the Oregon Health Plan, or OHP. And then our WIC team, so Women, Infants, and Children, which is supplemental nutrition for young children and new and expecting parents, has been extremely busy with new clients. And so they are always accepting new patients, and that whole team is bilingual English, Spanish. It's a great resource for our community. I read at the state level, our WIC program in the state of Oregon has accepted over 1,200 new clients in the last 2 weeks alone. So it's a service that's here for you, and we're more than happy to help get you signed up for that.
Yeah, it sounds like we have capacity too.
We do, yeah. It's a great team. They're working so hard. They're doing all their appointments virtually by phone right now for everyone's safety. We have a registered dietitian on that team, and they're really here to help support you through any changes you might be experiencing.
So things like the problem gambling, do those services continue to be provided as well?
They do, yeah. We also have a 24/7 crisis line, so if anyone's in crisis, that's a line that you can call for help. all of our behavioral health services are continuing as usual. It just might look a little bit different, like you might be on a phone appointment versus a face-to-face appointment, and we're not doing groups right now. But I think that having someone to talk to and reflect back on this experience with is always helpful. So even if you haven't had experience working with a mental health professional before and you're feeling down and stressed and overwhelmed, now's a great time to reach out and get signed up for those services.
And kind of maybe a random question, you know, I remember many, many years ago when I thought of seeing the clinic, that I would go to the Nice Street building. And then somewhere along the line, we got a federally qualified health center. Nice Street continues to be open for certain things too. Is that right?
It's mostly by phone right now.
Okay.
So the services there are a lot of our child and family therapy appointments, which are being done by phone. Our WIC team is there, which is being done by phone. And then our communicable disease nurses are seeing people on occasion, but that's mostly surrounding things like getting people antibiotics for sexual health concerns.
Gotcha. Well, fantastic. You know, I think as we start to close this out, Nicole, it's very likely we'll see more cases. I mean, the testing has increased too, right?
Yeah, the testing has increased. Right now, I think there are Samaritan, the Siletz Tribal Clinic, and then our federally qualified health center are all sites that can help with testing or at least guide you to the right place if you meet the criteria for testing. So as that increases, we know that we're going to find more positives. That's just how it works. The more you're looking for something, the more you're going to find it. And so the numbers are going to increase, and we want people to not feel, you know, frightened to see those numbers go up, but to just be really, really vigilant with taking care of yourself, with social distancing, and staying home if you can.
Yeah, that's the plan, and we'll continue to march on. Nicole, send us out of here with that call center phone number again.
Absolutely. So the call center phone number is 541-265-0621. You can also check out our website at www.co.lincoln.or.us/COVID.
Yep, and we continue to literally update that information every day. So, you know, kind of one of the things we're thinking of doing too in the coming days is maybe to give people a look inside our operations so you can see how our team mobilizes to keep the community as safe as we can. So thanks for joining us today, Nicole Fields. Thank you for being here.
Thanks, Casey.
Lots of great information. Really appreciate it. And we will see you same time, same place next week. And of course, look for the links and icons on Lincoln County's website. Stay healthy, everyone. Thanks for listening.